Hello, I'm James Mallory. I'm the chairman of the Iredell County Board of Commissioners, and I'm here today on Thursday, April the 2nd, to provide you the second installment of an update of what's going on in Iredell County relative to COVID-19 and our collective response to deal with the virus and to defeat it. This is really an update from last week's message. Shortly after we cut the videos last Thursday evening, we received a request from all three hospitals in Iredell County, Iredell Memorial, Davis Regional, and Lake Norman Regional, to institute a stay-at-home order. As you're probably aware, Mecklenburg County had just adopted a stay-at-home order at the request of their two primary hospital systems. They did so when the hospitals, having evaluated the numbers that they were seeing and the ages, primarily young and middle age, that were being identified as positive for COVID-19, were alarmed at the projections for how they might handle a surge of hospitalizations. So with some level of urgency, Mecklenburg County got together and within a few days had produced a order themselves. We observed that, obviously, and began to have discussions about whether that might be appropriate for Iredell County. We inquired whether there was a public health reason to institute that stay-at-home order, and at that time, there was not. And so we then when we received this request from our three hospital systems, we immediately the next day convened a work group from the county to evaluate their request and to identify additional information that we would like to have to understand the substance behind their request and how we might be able to react to whatever their concerns were. In that process, we did determine that, in large measure, the three hospitals' concerns related to the spillover effect from Mecklenburg County. Mecklenburg County is about a week or two ahead of us in terms of dealing with the transmission, the community transmission of COVID-19. So when they looked at the potential impacts on the Mecklenburg County hospital systems and the fact that we have a number of patients that are typically transferred to those hospitals for advanced care, as well as the potential for them having to transfer patients from Mecklenburg County to make room for COVID-19 patients. They were concerned about having an immediate impact as soon as Mecklenburg County was dealing with this situation. So, understanding that, we then contacted our municipal partners in Mooresville, Troutman, and Statesville, all three of whom have adopted state of emergency declarations in addition to the county. Now, legally, what that means is that if the county were to declare a stay-at-home order individually, then it would only apply to the unincorporated areas of the county. It would not apply to Mooresville, Troutman, or Statesville. Both Harmony and Love Valley are nesting under the Iredell County Declaration. So it made sense, obviously, because we have such sort of a spread of what Mooresville looks like. You have county property on one side of the street, you have city property on the other side of the street. And we want to make sure that we don't have differing interpretations of any kind of order, different enforcement priorities, different education processes. We wanted to be lockstep with no daylight between us. So we we're preparing to convene a discussion to see whether or not those municipalities wanted to move forward with a stay-at-home order, and we'd gotten some indications that Mooresville certainly was in favor of that. In the process, we learned from our legislative team in Raleigh that the governor was going to be having a press conference that Friday at 4 o'clock where he was going to outline, in all likelihood, a statewide stay-at-home order. We heard that from a number of different sources. So understanding that and figuring that whatever the governor was going to do was going to preempt whatever we did, we shifted our focus to looking at interpreting the governor's order, whatever that might be, and enforcement of that order. Sure enough, at 4 o'clock that Friday, Governor Cooper required all counties to follow a state stay-at-home order in which businesses were classified into essential businesses, and individuals were admonished to observe social distancing and the personal hygiene that goes along with defeating this virus and eradicating it. And so with all of that out there, we then convened a teleconference immediately after the governor's address and publication of his order, and determined that the first thing we wanted to look at was how are we going to enforce this, because violations of the governor's order is a Class 2 misdemeanor. So it's not the most serious misdemeanor in the world, but it is a misdemeanor, and it is a criminal charge, and it can go on someone's record, and it can go even no matter what the disposition, it's going to be showing up as something that's been charged against someone. So we wanted to make sure that we were going to have all of our law enforcement agencies unified in terms of the approach towards enforcement. And we got some direction from Sarah Kirkman, our district attorney, who in conjunction with our sheriff's department is tasked to enforce the laws of the state and our police departments. So what she put out, which was very helpful to us, is to understand that the district attorney is not going to soft pedal anyone charged with a misdemeanor, that she will prosecute folks charged with misdemeanors. So knowing that, we convened our attorneys to look at some of the legal ins and outs of how to best approach the enforcement mechanism. Subsequent to that, the governor has provided some guidance, and I will quote a little bit, to our Sheriff's Association for North Carolina, as well as the North Carolina Association of Chiefs of Police, where he notes that he trusts the judgment in handling compliance by reminding those who may be violating its provisions, particularly the social distancing and mass gathering limitations, about the requirements of the order. And his goal is to ensure that we have voluntary compliance. But at the end of the day, if it's necessary to ensure compliance, then a misdemeanor charge can be levied against someone. So we believe that there should be a warning process that graduates to a point where someone is actually cited for willfully ignoring these social distancing requirements, whether it's in business or whether it's personally. We will have additional information to publish in a joint resolution that will share some of those interpretations with the public. But our primary focus, we determined, should be one of education, just making sure that everyone understands why it is that we ask you to do what you're doing, and the importance not only to yourselves, but to your families, to your communities, and to our county and state as a whole. After the governor's order came into effect on Monday, he issued another order. This one dealt with directing utility companies to not terminate or cut off people's service if they were late with paying their utility bill. He also admonished and urged cable companies, cell phone companies, Wi-Fi, internet companies, likewise not to terminate service, and urged and admonished landlords and mortgage holders not to evict or to foreclose on people without giving them some element of grace and time to be able to work through their personal situations, as many people have been laid off as a result of these orders. Once again, those do not have the force and effect of law. They are being admonished to do so and urged. In the future, who knows exactly what legal actions may be taken by either Congress or our own legislature. After that second order, of course, the President Trump had taken a look at whether or not to extend the initial 15-day program to slow the spread of COVID-19. And after weighing all of the medical and scientific evidence, decided that that same program should be continued for another 30 days. In fact, all of you, anyone that has a post office box or has a mailing address, should have received or will be receiving President Trump's coronavirus guidelines for America, which are essentially those same points in his 15-day plan extended for 30 days. I can tell you, in my personal opinion, I think we'll go another 30 days beyond that, perhaps 45 days. From all indications, by the time this peaks in New York City, probably the middle of April, in terms of cases, peaks in terms of deaths in New York City, probably the end of April, that we're anywhere from 2 to 4 weeks behind them. So that puts us towards the end of May to middle of June before we can really be out of the woods or starting to get out of the woods as far as infections increasing and returning gradually to life as we know it, or some semblance of that. I would caution that this is likely to be a much longer fight than probably some think or we would all hope. If you look back in history, the 1918 Spanish flu pandemic came into being about the same time as this one, in the winter months. And in the summer months, it trailed off. But it came back in the fall and in the winter. And the second wave was worse than the first. And it targeted young people. So we need to be aware of that and understand that the social distancing in some form is going to be with us for a while. We may be able to ease back on it, but we may have to reintroduce it. But hopefully, we will be better prepared and better armed to deal with any kind of second wave. We will have testing capability that will be widely dispersed and quickly able to get results. We will have an opportunity to test people about antibodies that have been exposed and now have immunity. And there's the possibility that there could even be a vaccine developed by that time. That seems to be an optimistic projection, since most vaccines take about a year or more to prove out their effectiveness. But nonetheless, we'll have some additional weapons at our disposal to be able to deal with the situation if there's any second time around. And hopefully there isn't any. Hopefully we can stamp this thing out by the end of the summer. But for the next 4 weeks, you're going to see headlines from New York City to Washington area to Charlotte and even our own locality about large numbers of folks being infected, hospitalized, and even dying. The numbers that you see, and in Iredell County today, we have 36 confirmed cases. In the state map is always a little bit of a lagging indicator, and I think it shows 32 cases. To give you some context, Mecklenburg County, as of the last posting on the state map, had 495 cases. Other like counties to Iredell County that are in the metro region for Charlotte had higher counts than Iredell County. Union County, Cabarrus County, both in excess of 50. Rowan County, about the same as Iredell County. But you cannot look at those numbers and take that to the bank. They are the tip of the iceberg. What you don't see is the folks that have been infected, had mild to no symptoms, and yet were able to communicate that disease to others. There are a large number of folks that are going to be hospitalized. That's probably the hardest number that you're going to find. When you see hospitalizations, then you're going to get a sense of the folks that are at least having severe impacts. And of course, those that pass, you're going to be able to extrapolate back what your actual numbers were. But we're not going to get to those hard numbers for a month or a month and a half. So we just have to assume that everyone is carrying the virus and act accordingly. At the federal level, Congress has passed two primary pieces of legislation. The Congress passed the CARES Act, which deals with $2 trillion worth of expenditures to assist business, assist individuals, expand unemployment compensation, and in terms of duration and amount, a number of different initiatives to be able to help people and businesses power our way through this situation. There's also a Families First Coronavirus Response Act, and that deals with time off and some compensation for that in the event people have COVID-19 in their homes or they're not able to work for a variety of reasons. And it's very specific in terms of the conditions that have to be met in order to receive benefits under that particular act. So there's a lot of information being dumped everywhere, and the best source for that is our county website, which has links to a number of different resources. And our county manager, Beth Jones, will be able to share a little bit about that. What I want everyone to remember at the end of the day is, as I said, we're all soldiers in this fight. We have to look out for each other. We all have battle buddies. We all operate within units. And we have to be focused on the objective of moving through and defeating this enemy. Mecklenburg County is engaging that enemy now. We're going to be in the same kind of situation to some extent 1 to 2 weeks later. So we'll be carefully monitoring what's happening in Mecklenburg County. And of course, Governor Cooper will be making decisions about what's best to do for this state. So stay tuned, and we'll be back again next week. Thank you.